I isolated myself inside my car, and now I am parked where there is a residential area under the tree, wherein there is no really too much people around, because right now it was already concluded that this virus, the COVID-19, can be transmitted through airborne. So as much as possible, it's better to be outdoor than to be indoor. And this is the conclusion of the expert.
And good evening. Thanks for joining us on a Tuesday night. I'm Tom Yamas, in for David. And we begin with the surge of coronavirus sweeping across the country. Cases rising in more than 30 states tonight. Dr. Anthony Fauci warning we could be on track to see 100,000 cases a day, and that surge puts the entire country at risk. The outbreak is dividing America. Tonight, New York, the tri-state area, fearing the outbreak's return, now extending its quarantine order to visitors from 16 states, including California and Georgia. Texas, with a new record number of cases, just under 7,000 in a day. The state now extending its halt on elective surgeries to 8 counties. Arizona, with a record number of COVID patients in ICU beds, activating crisis standards at its hospitals. In Miami-Dade County, outreach teams are going door to door, handing out supplies, urging people to social distance and wear masks. And in California, where bars and beaches are shut down in several hot spots, the governor saying stricter stay-at-home restrictions may return. That announcement to come tomorrow. California is one of several states hitting pause or reversing course in an urgent rush to halt the spread. ABC's Matt Gutman leads us off in California.
Tonight in California, the first state to shut down and one of the last to reopen, COVID-19 exploding. Nearly 250,000 cases, and the governor with a stern warning.
If you're not going to stay home and you're not going to wear masks in public, we have to enforce, and we will.
The situation so dire that New York, New Jersey, and Connecticut, which have beaten back COVID after tens of thousands of deaths, now slapping a 14-day quarantine on visitors from California and a growing list of 15 other states where the virus is surging. With the nation notching 40,000 new cases a day, Dr. Anthony Fauci today warning those case numbers could easily double.
I would not be surprised if we go up to 100,000 a day if this does not turn around, and so I am very concerned. I think it's important to tell you and the American public that I'm very concerned because it could get very bad.
It is bad in California's Farm Belt of Imperial County. So overwhelmed, they've medevaced over 500 patients out of the county. And outside that hospital, a tent to handle the surge of patients. Morgues have backed up, and now the county is ordering refrigerated trucks for the dead. And nearby Riverside County, 99% of the ICUs full.
We're seeing a large number of cases coming in where multiple family members are infected.
Los Angeles County, with over 100,000 cases alone, closing beaches and banning fireworks over the 4th of July weekend. 51-year-old Tommy Macias of California sharing on Facebook that he was diagnosed with COVID after going to a barbecue. Because of my stupidity, I put my mom and sisters and my family's health in jeopardy. This has been a very painful experience. His family says he was a diabetic and had been careful wearing masks and social distancing for months. Tommy Macias passed away the day he went to the hospital.
It was absolutely shocking. I wasn't in the room when my mom got the call. I heard her cry out. I just didn't want to, I still don't want to believe it.
With the virus rising in 35 states, 17 states either pausing or rolling back reopenings. In Arizona, deaths climbing. Our Kaylee Hartung with paramedics on COVID calls in Mesa. Today, a 40-year-old patient with trouble breathing. His mother rushing to see him before he's taken to the hospital.
I just came so I could, because, we can't see them. We can't talk, so, well, anyway, I just wanted to see him, that's all.
That separation for COVID patients and their families so difficult. Matt joins us now from a testing site at Dodger Stadium. And Matt, California's governor with a real warning tonight. Many anxious to know if the state is going to see more restrictions again. Tom, the governor talked about toggling back on those stay-at-home orders, which likely means reinstituting a lot of those restrictions that we've been seeing over the past couple of months. Now, I mentioned something we haven't heard much about recently, and that is enforcement, but he didn't specify. One thing that is clear, the number of cars at this testing site, the traffic goes back for miles, which likely means the number of COVID cases here is going to continue to soar. Tom.
Ito yung aking face shield and then face mask. Binigay ko ito ng aking pamangkin ni Mike. This is about $50 so itong M9 na ito. This is the only safest na face mask. Dahil itong klaseng ito na face mask, hindi ako makatagal ng 30 minutes na suit-suit ito. I'm breathing my carbon dioxide at nagkakaroon ho ng nagiging acidic ang aking hong blood. Once I'm going to wear this for 24 hours, it will increase now yung carbon dioxide ho sa aking katawan, and it will now magiging imbalance ho. Ang aking pH magiging acidic. So, it will, rather than helping me, it is going to kill me. Especially kamukha po natin ng mga senior citizen. This is the best one. Anyway, this one you can clean it, use it again. Anyway, since we know already like that
It's the most
the spreader
recommended
of this
can
virus
really
is
kill
us
the virus.
when we cough,
Dahil may
we
there's a lot of
sneeze,
things that should
and
be,
even by talking.
people should learn.
So,
And
there is
then,
a study
the
that was
one
done
face
that the aerosol,
shield that I made,
so once you sneeze, but
so
if
that
we can prevent
touching our
that
face.
to become airborne,
Ano?
okay, the space shield also will prevent it. Remember that. So once
This
you
is
cough,
the
you sneeze,
incubus.
okay,
Okay?
the flow
Amen.
or the turbulence that will come out from your mouth will be all I need is just to add a clip and it will clip to my eyeglasses. Alright? And one thing good about this face shield, okay, it says that what is the main problem with the spreader? Okay, when they cough, it will airborne. And with this face shield that I created, when you cough, it will be contained here only, okay? And then the turbulence that will come out from your coughing or sneezing, okay, it will go down. Alright? It will not go up. It will go down. Okay? So, if we can minimize the, okay, for the one that have already the virus that we don't know, like for example, those asymptomatic, the spreader, we can minimize the spreader. That's the reason this is highly contagious. That's the reason for one person to contaminate, because as what they said, it will stay airborne for how many hours? Okay. The only way it can stay airborne is when you cough without like this, the face shield that I created, when you cough, okay, it will be contained inside, and it will come out, but down. And that is the beauty of this face shield that I created. Okay? Okay. This is the improvement that I have done to the face shield, so that I can be protected from the airborne virus. I think this is the biggest problem that we're having right now. Okay? And then I put some extension to this face shield, like that. Okay? So that I can breathe easy. And then plus this one, okay, to cover it up. What is the most important one is to protect your face from the airborne virus that is now in aerosol. I think that's the biggest problem we're having. That's the reason the spreader is so, that's the reason the COVID virus is so contagious and so spreading like a wildfire, because of the airborne that is being at least 1 hour aerosol. Okay, these are the some of the innovation that I did to my face shield. It's really becoming now, because of the situation right now, many are being infected right now here in California. To date, more than 50,000 was recorded, and that is only what was recorded, and we don't know really the real statistics. And then now the dead are now being refrigerated. It's now overwhelming, and I hope people will have this precaution. Okay, because the most deadliest kind of infection that you're going to get from COVID-19 is once it is airborne. It stays more than an hour being airborne. And I'll be using this face shield once I'll go to people, like for example, if I'm going to buy some food, if I go to a grocery in which there will be a lot of people over there buying also their own food, I'll be wearing this face shield, and it looks like it's really from outer space, but who cares? Okay, you have only one life, and I'm a senior citizen. I have to protect myself. I have to save myself, so I have now to innovate, invent something that I know will protect me. Okay, now, this is really the most important thing about be practical and use your common sense. Since actually it's up to you to make some decision.
Coronavirus can persist on surfaces for days, in air for hours. The following information is based on what is published in globalnews.ca. The highly contagious novel coronavirus that has exploded into a global pandemic can remain viable and infectious in droplets in the air for hours and on surfaces up to days, according to a new study that should offer guidance to help people avoid contracting the respiratory illness called COVID-19. Scientists from the National Institute of Allergy and Infectious Diseases (NIAID), part of the U.S. National Institutes of Health, attempted to mimic the virus deposited from an infected person onto everyday surfaces in a household or hospital setting, such as through coughing or touching objects. They used a device to dispense an aerosol that duplicated the microscopic droplets created in a cough or a sneeze. The scientists then investigated how long the virus remained infectious on these surfaces, according to the study that appeared online in the New England Journal of Medicine on Tuesday, a day in which US COVID-19 cases surged past 5,200 and deaths approached 100. The tests showed that when the virus is carried by the droplets released when someone coughs or sneezes, it remains viable, or able to still infect people, in aerosols for at least 3 hours. On plastic and stainless steel, viable virus could be detected after 3 days. On cardboard, the virus was not viable after 24 hours. On copper, it took 4 hours for the virus to become inactivated. In terms of half-life, the research team found that it takes about 66 minutes for half the virus particles to lose function if they are in an aerosol droplet. That means that after another hour and 6 minutes, 3/4 of the virus particles will be essentially inactivated, but 25% will still be viable. The amount of viable virus at the end of the 3rd hour will be down to 12.5%, according to the research led by Neeltje van Doormalen of the NIAID's Montana facility at Rocky Mountain Laboratories. On stainless steel, it takes 5 hours 38 minutes for half of the virus particles to become inactive. On plastic, the half-life is 6 hours 49 minutes, researchers found. On cardboard, the half-life was about 3.5 hours, but the researchers said there was a lot of variability in those results, so we advise caution interpreting that number. The shortest survival time was on copper, where half the virus became inactivated within 46 minutes.
I have here a, I made this one, okay, from a, where a candy used to be, okay? Garapon ng candy na plastic. Kinat ko, ginawa kong face shield. Anyway, this is funny, but it can be helpful, okay? Now you see, what it looks like. Really funny, okay? But it's really, it fits my face, okay? There are 3 ways for you to be infected by this virus, the COVID-19. Through eyes, okay? Through your nose, and through your mouth. And how are you going to be infected, okay? Once the person that is a carrier, which means already infected by the virus, once he is going to cough, sneeze, or even they said by talking. And what is the most effective way to prevent that? Okay, they're so simple. Okay, first, your hands. Okay, you have to wash always your hands with with soap or any alcohol. All right, washing, and then by preventing, touching your face, touching your eyes, touching your nose or your mouth before you touch your mouth. Okay, because we cannot prevent in touching our face, so you must have a face shield, the most important one. Simple. All right. I was thinking about how are we going to prevent that we will be infected by this virus. Okay, we cannot see. There are only 3 ways that you can be infected. Okay, to go inside your body. All right, through your eyes. Once you touch, that is already proven. They said through your eyes, through your nose, and through your mouth. And how are you going to be infected? The most important thing. All right. Once somebody that is already a carrier, there are some that is asymptomatic, no symptoms. Okay, they say even through talking, you can be infected. That is really, people don't even take that into consideration. Remember this is your life. You will do everything that you want to be protected. Okay, everybody will die, but you don't want, like a duck cannot even quack. So, right now, this is not a joke. Okay, this virus is not a joke. It's killing a lot of people already, especially here in the United States of America. And you know what? Resources are becoming, everybody is now trying to protect himself. And I hope everybody should be resourceful. You know what? Try to use your imagination. What you have right now, man, there's a lot of things. This is only a simple thing to prevent infection. You know what? Prevent it in going inside your body. The most important thing about this virus, okay? Prevention. Okay, the virus is invisible, okay? But invisible, but that it can be transmitted through what? Coughing, sneezing, even talking. So now, now the cause, okay? For you to be infected. Common sense, sentido común, okay? Wag ka bang to be like all-knowing fool. Don't be a fool, okay? Or stupid. You know what? I am ignorant, but I can learn. And
COVID-19 is believed to be transmitted primarily through inhalation. Once infected, most people experience mild symptoms, including sore throat, headache, fever, a dry cough, shortness of breath, and fatigue. However, in a subset of patients, the virus attacks the lungs, causing a much more serious infection. Small air sacs in the lungs add oxygen to your blood cells. This oxygen is then transported to organs and tissues throughout the body. When the coronavirus attaches to a cell, it begins to replicate within the cell. The body's immune system attempts to destroy the virus, which results in an inflammatory response that causes fluid accumulation in the lungs. As the lungs fill with fluid, the body's available oxygen decreases, which can lead to organ injury and death. The risk of serious complications increases if a person is elderly or has associated medical conditions. Once infected, a person may show no symptoms but can still infect others. What began in Wuhan has now spread across the globe.